Welcome back, everyone. We're going to go ahead and get back started. We'll be now starting our next session, which will feature roundtable discussions. The first roundtable will address funding of health IT modernization in Indian country. I'll now welcome Erin Morris and Rhonda Harjo from the National Indian Health Board, who will be moderating this session and will introduce their panelists.
Thank you. Happy to join all of you today. I want to take this time to welcome our speakers today for this roundtable concerning funding streams that are available for electronic health records and health IT modernization, as well as the funding for it. So our panelists today will be Natasha John, who is with the Pyles law firm, who works as a director of tribal government relations. And we also have Jonathan Arnold, who is the Chief Technology Officer at ATI Solutions, which is a Native American tribal entity who applies best suited technology to deliver cost-effective systems to federal customers, as well as mentoring in the art of federal consulting. And also we have Chairwoman Amber Torres of the Walker River Paiute tribe out of Nevada, who also serves as this past year's co-chair for the National Tribal Budget Formulation Work Group. And so I'm really happy to join them. I'm going to turn it over to our first panelist, who is Natasha.
Hello, everyone. My name is Natasha John, and like Erin said, I'm a director of tribal government relations at Pyles Law, and I have previously worked at the Senate Committee on Indian Affairs, and also I worked for my tribe, Navajo Nation, in Washington, D.C., and also some other private firms in the Washington, D.C. area. So, So I wanted to talk to you today about some of the federal funding streams that have been available for health IT, broadband infrastructure, cost, speeds, that type of thing. This has really taken a huge interest in Congress as the pandemic has occurred. Everybody moved to a more virtual world where they were doing virtual meetings. Telehealth was promoted. Cybersecurity became a huge deal as our health data was online more, as people were using, telehealth visits more often. Our Internet of Things became greater. We needed a good high-speed internet in order to participate in these, high-resolution telehealth meetings, virtual consultations, that kind of stuff. And so, the healthit.gov has mentioned that 1,000 megabits per second is what a large medical facility or academic institution needs. And so I think, the better your connection, the better your telehealth will be. So this first slide that Erin has put up is a little overview of some of the health IT and broadband type of health funding streams that Congress decided to fund during this COVID pandemic. So through the Coronavirus Preparedness and Response Supplementary Appropriations Act, they provided the CDC with supporting tribal health, public health capacity in coronavirus prepared and response grants. And so those type of eligible fundings included data management, strengthening information management, and that closed in June of 2020. The next two coronavirus bills, the Families First Coronavirus Response Act and the Paycheck Protection Program and Healthcare Enhancement Act, were more of direct funding to tribal health programs. So we had $61 million for 638 contracts and compact agreements. And then we had in the PPP, we have $550 million for IHS federal health programs and tribal health programs. And that was through existing formulas. So that's kind of how the first part of the pandemic was being funded. I think this is important to go over some of these past funding streams because you can look at usaspending.gov to see who actually got the grants and what tribes may need assistance, what tribal organizations may need assistance. A lot of this federal funding is coming not just one fiscal year, it's coming in multiple fiscal years. So I think that's important to help, provide more workforce development and all of the things that support the health infrastructure, not just, the hard stuff. So the next big funding stream for this targeted area that we're working on was the CARES Act, or the Coronavirus Aid, Relief, and Economic Security Act. So that also provided some direct funding to tribes through the Coronavirus Relief Fund. And then there was some more targeted funding to the Indian Health Service with $95 million for COVID-related telehealth needs. And that was available through 2021, but it included purchasing equipment and software and other telehealth needs. And then 24 million of that was for education, outreach, training, technical assistance, contract management, coordination, and program policy development, as well as acquisition of clinical video telehealth solutions. So all of that's within this space that we're working on. So tribes may, have telehealth areas may have this ability to do this, but the equipment is still there. They're still, wondering how to use it, what to do with it. It's going to be there for a while. So the Indian Health Service also provided $65 million for the resources and patient management system for the electronic health record. I think that the Indian Health Service is moving away from that now, as they announced it in Dear Tribal Leader letter in April. So I think that was just something to, hit in at the time when it was needed. HRSA has Rural Tribal COVID Response Program with $15 million. That closed in May of this year. Then also HRSA also had the Telehealth Network Grant Program, which closed in June of last year. And then USDA has the Distance Learning and Telemedicine grants, and that can be used for computer, hardware, and software, terminal and data terminal equipment, and that closed in 2020. That's a program that wasn't specific to the CARES Act, so they may have additional rounds coming up in the future. And then also there was the FCC, Federal Communications Commission COVID telehealth programs that received $200 million. So that's that. And then if we go to the next slide, we have some more funding streams that came through with the ARPA funding. So this is still COVID related. The Coronavirus State and Local Relief Fund was provided direct aid to tribes as well. There was also the Emergency Rural Health Care Grants, which provided $500 million. And part of those eligible uses were for expanding access to telehealth, electronic health data sharing, and that closed in October of 2021. And then lastly, for these big coronavirus relief packages, we have the Consolidated Appropriations Act 2021, and that's provided some additional funding to the Department of Commerce Tribal Broadband Connectivity Program, which allocated $1 billion, and then also changed one of the FCC programs to, I think it changed the name, but it provides still 65% discount for eligible healthcare providers for broadband service, equipment, connections, research, education networks. And so that closed in 2021. And then the BIA also has, that has various openings funded just through their normal appropriations, is the National Tribal Broadband Grant, which can be used for broadband studies, for assessment needs assessments, that type of stuff. And then I also want to mention that the FCC has had various programs for tribes to access first priority spectrum. And I think that's really important for tribes if they're interested in controlling the throttling within their own jurisdictions, for their own networks, for, however they want to, speed up programs, provide access to certain things. So I just want to mention that as well. If we could go to the next slide, I think that'd be good. So this slide is for funding streams that are currently open. If NIHB is going to share the slides, they're linked, so you can hit directly to the grants.gov announcement if you need. USDA, this is a big one, has a broadband reconnect program that tribes are eligible for. This is, you can use it for various things, but infrastructure and service speed, I think, is some of the things that tribes may be interested in using this for. HRSA will also has a health center program service area competition. This is, there's no tribal status side in this, but Indian tribes are eligible for that. So that closes in February 2020, as well as the Reconnect program. The FCC is going to have the emergency broadband benefit, or has currently the emergency broadband benefit program that provides $75 per month for households on qualifying tribal lands. Households may apply for that. And then the National Institutes of Health has the mobile health technology and outcomes in low and middle income areas. And this is for mobile health interventions. So I think some of these you can apply as a tribe, you can apply as a consortium. And this can be for emerging or new technologies with platform systems and analysis. So this is various different areas that you can, use your technology expansion for. And this is, something you may not have thought about before. And then the Department of Commerce, EDA, has the American Rescue Plan Act Indigenous Communities funding, and this is for community health facilities, can be used for community health facilities. This is for Indigenous communities specific. And so that's deadline is apply as soon as possible, but is through September of 2022. So these are all currently open things. If they have a bit of a future of a deadline, but something you can think about right now. So if we go to the next slide, we have also on grants.gov, this will be your new favorite place. There are forecasted opportunities. And so I think there's a leading edge acceleration projects for health IT. This is for innovation projects. Another maybe good one to do a consortium application for. The FCC Affordable Connectivity Program. This is what the Emergency Broadband Program is going to be renamed. Still $75 per month per household on qualifying tribal lands. And then through the infrastructure bill, we have the Department of Commerce. NTIA has several different broadband programs that have some upcoming public listening sessions for the Middle Mile program and the Digital Equity Competition Grant Program. There will be virtual listening sessions on the 15th for the public. So we'll find out more information about how the administration will be implementing those programs. And then also, this is just a re-mention of the $1 billion for the Tribal Broadband Connectivity Program. So those are things that we know are coming down the pipes in the administration. And then my last slide here is to talk a little bit about what Congress is doing to address these items. I think part of what I do in the government affairs field is to take people's on the ground ideas and advocate to Congress about the needs, the funding that might be available. And so there are a couple of opportunities that are out there, public, for people to know about for broadband. And one of them is the bill HR 1047, the Rural Broadband Permitting Efficiency Act. And this helps reduce red tape and requires the Department of Agriculture and the Department of Interior to establish a voluntary program for Indian tribes. They can opt into environmental review agreements for permitting their broadband projects. So this is at the other end of the spectrum, right? Someplace that needs some infrastructure. Maybe there's nothing there to tap into, needs to be in the ground with the shovel, ready to go. So the second item I have on here is one that everyone's been talking about, the Build Back Better Act, that we'll see where Joe Manchin is, where it is pending in the Senate. The text could change, but what we have in there so far is providing $50 million for Native Hawaiian healthcare systems. We also have a career pathways through health profession opportunity grants. This will provide 10 eligible Indian tribes, Alaska Native corporations, tribal organizations, or TCUs to conduct a project to train low-income individuals for allied health professions, including health information technology. So I think that that's really great for workforce development. And then also we have funding for nursing education enhancement and modernization grants in underserved areas. This provides $500 million for nursing schools to enhance and modernize nursing education programs and recruit faculty and students. So that's a pretty broad eligibility. And if that ends up making it to public law, we can see, what more targeted that might be. And then lastly, we have promoting equity and maternity health outcomes through digital tools, and that provides 30 million, of which tribes are eligible to apply. Tribal organizations and healthcare providers are eligible, and that is to increase access to digital tools to reduce racial and ethnic disparities in maternal health. So I think this is a new environment from when I was working on this, 5-10 years ago. So there's a lot of good opportunities that have been funded by Congress, are going to be funded by Congress, and potentially could be funded by Congress. So I think Build Back Better, there's still opportunities to maybe, put some more advocacy in there, but always Congress is available to be shaped and molded and influenced. And so that's part of the reason why we're here today. So thank you so much for listening, and I hope to answer any questions you may have.
Thank you so much, Natasha, for that presentation. I wanted to take a chance to see if anybody's raised their hand or has a question for Natasha about any of these funding streams that are available. Okay, well, thank you. Well, certainly we hope you'll consider all those in mind, and we'll be sure to especially share the information you had linking to all of the different federal announcements. Oh, and yes. So I see, Joe, can we get a document for all of the funding streams? Yes, we'll be able to share that. And then Gina Roanhorse has asked, do tribes have to submit the application, or can 638 programs submit?
I think you'll have to look at each individual funding stream. I think normally when they're saying Indian tribe, I think there's usually a DUNS number, and however a tribe usually goes about doing federal funding applications. I think that's the way you should go for Indian tribe. It could be different for your tribal health programs. So you just have to look at each individual announcement.
Okay, and then Sarah Morrison asked, can you repeat how much is being discussed for the career pathways development?
So I think that one just provides a direction for 10 eligible entities. I don't think that it provided specific funding. So I think we'll just have to wait if that becomes law to see how that's going to be allocated.
Okay, thanks. And so if anybody else has a question that they think of during the rest of this hour, please just put it in the chat or raise your hand, and we'll make sure to recognize you. But we'll go ahead and move on to Mr. Jonathan Arnold of ATI, and I will go ahead and, John, get your screen shared up here.
Thank you very much. You can go to the next slide. That's just to remind me of where I'm talking and when. So I'm Jonathan Arnold. I'm the Chief Technology Officer of ATI Government Solutions, LLC, which is a tribal entity owned by the Susanville Indian Rancheria. And I'm here to talk about IT infrastructure upgrades and what we've done. And I thought I would do the talk by telling you what we have done and some of the obstacles that we've encountered. And I realize that time is short. So this first slide basically lets you know about the Susanville Indian Rancheria. It's relatively small compared to maybe some of the other tribal organizations. And, when you talk about telehealth, one of the big things is getting to the last mile. And that's always hard. I live in the Shenandoah Valley, and I don't have last mile connectivity through any cable or anything like that. Everything's wireless, just because we don't have enough houses to justify the telco provider doing that. In the Rancheria, it's even harder because it's extremely mountainous. It's hard to drive across the land owned by the Rancheria, much less to get cable to every residence. And some of the residents do not have a fixed location, and so that makes it extremely difficult. So we have to use different technologies to get last mile connectivity. So here is just a description of the Rancheria and some of the obstacles, not only terrain and weather, but even things like education, and how do you get folks to use the internet if they're concerned about using it, scared of using it, or just haven't had a lot of experience. Next slide, please. On top of all that, there was a fire. And of course, this made CNN for many days in a row. But this fire burned Lassen County, and it actually cut the fiber optic line that connected the Rancheria to the rest of the world. And for some number of days, there was no connectivity. So the folks at the Lassen Indian Health Center couldn't actually do consults. And there was no way to get connectivity until they brought cows. Now, cows, in this case, is cell towers on wheels. Yeah, very, very fancy abbreviation. And you see an example of a cow here on the lower right. So fortunately, the IT folks at the Rancheria who helped with this presentation are very, very smart and very quick and well connected. And we're able to convince the provider to bring in these cows and set them up at strategic locations. The map on the upper right shows you where you have broadband connectivity. And if you notice, it stops short of Susanville and the Rancheria. And it's never going to extend there. The economics doesn't work. The terrain is hard to work with. And the occasional wildfire puts everything at risk. So, this is a problem that has to be solved different ways. And it has to be solved not only to deliver healthcare, but also to deliver educational opportunities, which is actually intertwined with how we can deliver healthcare inexpensively and get really good outcomes. Next slide, please. So when we looked at, what it would take to deliver, high quality healthcare and get positive outcomes, we interviewed the practitioners. And, I'm part Native American myself, so I suffer from some of these effects, but it turns out that the Native American population has higher incidence of things like chronic obstructive pulmonary disease, has higher incidence of dental problems, alcoholism, unfortunately, and other issues. And you just can't deliver healthcare on that terrain and in that area through sort of a standard, process that we might use in an urban setting, right? There has to be high touch, repeated contacts, and a lot of education. And so, we need the broadband to have enough capacity to do things like send films to other consultants, in Reno. We need to be able to deliver educational materials, patient educational materials through a portal using broadband. And right now, there's just not enough connectivity to do that. We have good connectivity from the outside world to the Rancheria itself, but getting to the last mile is extremely difficult given that terrain and some of the other constraints. And so we thought that this would be easy, upgrade your hardware, get a telecommunications infrastructure in place. It turns out that for starters, there's something called a Medi-Cal, which has different requirements for filing insurance reimbursements and things like that than Medicare and everything else. In fact, one great legislative agenda might be to standardize all this. That would certainly make it easier to deliver good quality care, good quality electronic health management systems across our nation's tribes, right? If everybody has different requirements and mandates, it's very expensive. And each of these systems did not satisfy all of the mandates. There's just no way. So part of this is regulatory obstacles. Part of it's also that the cloud, even though it's touted as the end all be all, you got to have a lot more telecommunications capacity to use it. Nothing is local. Everything is remote. And you've got to be able to ship large image files and do consults. not only with the patient, but also with the experts in Reno and some of the other big cities, right, that have focused expertise. This actually imposes, a tremendous amount of burden on the systems. And the systems that we have now don't meet the standards. We need to upgrade the pipes, the big pipelines, so that we can get the right bandwidth to these Indian health centers. Simple updates are complicated. It was hard to implement the COVID-19 vaccine, and it changed from 2 to 2 plus a booster, and who knows what else is going to happen as this thing continues, right? It's not just a database field. It's actually somewhat difficult to do that. The other thing is, since these systems are all different and have different strengths and weaknesses, this is not about implementation. This is about integration. Next slide. So we talked to the clinicians, we talked to the people actually delivering the care, and we wanted to understand what their real problems were. As how are you treating the population, and what kind of tools and techniques do you need to treat the population? What we found is that broadband adoption is a big issue. People don't know how to use the internet. And frankly, that's not an issue just associated with Native Americans. That's an issue even in my own household to a certain extent. So education, training, help desk support, those are key elements to encouraging broadband adoption. The other thing is that we had to be provably secure, which is not just an investment in network infrastructure, but also the network management and monitoring tools. That's software and training. And hopefully a native workforce can assume those responsibilities. But in the beginning, it has to be work done by outside consultants until people are trained up. And that's true not just in, again, Native American, the rancheria, but it's true in any enterprise. You got to get people to know how to use these tools. It's extremely complicated. These health systems, they don't all do everything we want them to do. So we have to be able to interface and build a way to connect them, to send data from something that's good at like diagnostic and procedures to something that's good for financials. Some healthcare systems are better, or electronic records management systems are better at financials, and you want to be able to use that. So it's more than just plugging these things together. There has to be platforms and software built. And what we learned is it's integration, which is harder than just rolling out a system. And it's, there's sort of unexpected complexities in configuring these systems. And we have to pay attention to the cybersecurity, and that's a several-hour presentation, but the bottom line is we have to have the right tools to monitor, and they have to be deployed not only co-located with the electronic health records management system, but across the entire network, because the entire network has to be secure. And we also learned, because of the fire, that we need redundant connections to the outside world. We can't afford to have our sole fiber optic be burned and unable to be useful. Next slide. So these are sort of the problems that we found and the solutions that we implemented. And these solutions were hard won. We had to do a feasibility study. We had to, talk to a lot of different people, a lot of different stakeholders, people that knew what the situation was on the ground. It's one thing to engage a consultancy that can kind of talk at a high level of abstraction, but it's another to actually walk the rancheria, to understand exactly what the problems are, to talk to the clinicians and understand what they're trying to deliver, to talk to the people and understand who they're consulting with. Are they located in Reno? Are they located in Las Vegas? How long does it take for somebody to drive to the Lassen Indian Health Center versus can we do something on the telephone if we can get enough connectivity to that telephone? And not everybody has a telephone that's smart. Not everybody has a laptop. Not everybody has wireless capability inside their residence. So if we're going to actually build something to connect people to the internet, to take advantage of it, we've got to be able to give them the tools to do that and train them to do that. And so what we are proposing is not just a point solution, but an end-to-end solution that not only delivers better bandwidth, which is going to have better health outcomes, but also training, not just training for the people that use the internet or use the broadband, but also training for the people that support it. And what we really want is for that to be supported by the folks that are living on the rancheria, right? because that is the way to prosperity, education. And it can't just start at college. You know, if you remember the first slide, you know, 25% of the folks that went to high school missed classes because of COVID-19. We have to have programs that reach back through high school, through elementary school. And really the combination of high-speed broadband, the combination of help desk, educational opportunities, and telehealth is a great platform to deploy and test and iron out all those things, because to do that successfully really requires a holistic approach, you know, technology, workforce training. And my mom actually talks about the 7-generation plan. And it really is a 7-generation thing. It's not like we can take people right away and, you know, easily equip them to handle, you know, cybersecurity. We can make a start, but we have to reach down into, you know, the upcoming generations. So next slide. So, and this is the bigger picture. I won't go into it so much, except that it's not just technical, not just terrain, not just workforce, but these mandates are very difficult to deal with. And it's amazing that in this country, we actually allow that to happen, right? That we have very different requirements to file for Medi-Cal versus Medicare. And so some of this is legislation. And that's also probably a 7-generation activity, right? Because these things don't move very fast. Next slide. And hopefully you found this interesting. These are true stories. The names were not changed to protect the innocent. And I had a lot of help with this from the folks at the Rancheria. Thank you all very much. And I'm happy to answer any questions.
Thanks, John. So I have one question in the chat of, have you ever looked into using Starlink and using in these remote communities?
Yes, what we decided was microwave. That just seemed to be easier in the budget, something that people were familiar with and something our local providers were familiar with.
Okay, and Rhonda, I see you have your hand up.
Hi, I was just joining in and happy to be here. Really happy to have Natasha and Jonathan joining us today and providing this really extensive amount of information. And wow, it's just a lot of things going on, so much to consider here, but I'm glad that they're a part of this and, and providing this to all of our people watching today. I just kind of wanted to touch base on a few items, and maybe if as other questions come in, we'll stop and go back to the questions. But Erin, maybe if we could just circle back to some of the things that were raised by Natasha and Jonathan. And I think it's really important. Some of the things Jonathan touched about was the vision of the tribe and how that really drove what's going on with their company and with their reservation, and not only to build something in this kind of remote, very rugged terrain, which sort of exemplifies many areas of Indian country. They were able to get into alternative strategies and to look at this in a long-term approach to grow their own. And I think that's probably, to me, one of the most fascinating parts of it, is to be able to see to the next generation, to the 7 generations, and start developing programs for their children. And so as part of that, Natasha, she mentioned in the different funding streams available, broadband studies. What kind of studies are out there? What kind of studies have been done? And what kind of studies should be done? What are those topics and areas that maybe people ought to be thinking about for these studies? Jonathan mentioned the end-to-end solution, which is part of the growing your own, workforce development, and other types of things. So maybe Natasha and Jonathan, maybe you guys could provide some views on some of the different studies that have been done and what maybe people ought to be thinking about for the different studies, not only tribes, but agencies as well. Mm-hmm.
Sure, I can talk a little bit about that. I know the Government Accountability Office has done a lot of different studies on broadband and internet access for tribal communities, cost, infrastructure, permitting, that kind of stuff. And I think that that has been well developed in the federal policy space. I think when we're talking more about the IT infrastructure, I think that for health, I think that that's something that could be on the funding needs specifically, like studied a little more. I know that tribes have been, prior to the pandemic, using their own funding to, update their electronic health record management systems and other things like that. And so I think, that's something that is timely and could be supported to help show Congress, where people are in that field. I know that when I worked in the Navajo Nation, they were doing their own needs assessment on the whole nation about not just health IT, but the whole nation, like what needed to be protected for cybersecurity, what areas didn't. So in Navajo, right, it can be very rural where there's no phone service, cell phone service, there's no electricity even. So like that could be like very the very beginning of this whole thing, right? And then they have in Window Rock where there's pretty good internet access, like there's the central part of the government is there. They need probably more people that need assistance with help desk type of stuff, like workforce development. So that's the whole gamut. And I think that they were just really working on all of those different aspects and what they needed for this vision, right? That's something that Ron is talking about. And I think every tribe needs to have something like that for themselves. And I do think that the FCC has ongoing studies about speeds and how reporting gets done from telecommunications providers, whether that be tribally owned or outside of the tribe. And so I think that they have information gathering that's going on right now. I forgot specifically what it is, but I think tribes can comment on that. The Office of Native American Affairs has reached out to tribes to get their input on what data points should be researched. And so I think those are some of the areas that I would talk about studies. And Jonathan, I'll pass it on to you.
Well, thank you. You did a great job summarizing, the high level concepts. And what we did to drill down into some more detail, we looked at things like, what are the business requirements for, how many concurrent calls do you need to be able to support for patients and for consults? What are the size files you need to transmit? How fast do those files, how much time do you have to transmit those files? The other thing that we looked at was there are standards, ISO standards for speeds, telco speeds that should be accessible to, large scale hospitals as well as health centers that might be smaller scale. So we use that because it's very hard for, at least in our area, we certainly weren't there. So it was kind of good to be able to say, here's the standard that everybody agrees to, and we need help to get there. The other thing is that the clinicians talked a lot about how people didn't know how to use the cell phone or the iPad or the computer to help them. Like somebody's a patient, but they don't know how to use the cell phone to help them, get telehealth services, right? So, and a lot of these things that are quote help desk functions, for lack of a better term, are actually opportunities to do workforce training and to start inculcating training and IT know-how to the local workforce. They seem pretty simple if you're used to using them, but they're not if you're not. And it's great to be able to say to high school kids and folks just out of high school and even retirees, here's how you can help a prospective patient use the telehealth tools. And it's relatively low cost and you can spread a lot of knowledge around that way. And so we looked at, everything from the final delivery over the last mile to supporting, clinicians and healthcare recipients, to consults, and then the whole cybersecurity issue. The short answer is you need a solution that's across all the networks, not just the health IT infrastructure. So hopefully that was helpful in amplifying what you just said. Thank you.
Somebody have a question?
Okay, so I have one question in the chat for Mr. Arnold. So integrating microwave, how is broadband ultimately delivered to the home? Is it a micro dish receiver? Is there a community wireless broadband component? And has there ever been a tribe involved in an actual build out like in Nisqually in Washington?
So the short answer is there is a microwave component, and we've spec'd out the antennas, the receivers and the antennas, as well as the modems, and even wireless Wi-Fi routers and hubs for the residents, for lack of a better word, because you need all that or you can't use it. And then so it's delivered through the small receivers. We're actually looking at acquiring spectrum, so I think that answers the second question. And yes, the tribe is actively involved. There's a very good, hardworking, overstretched IT department, and then we tried to get as many people involved. It's sort of a sales and marketing effort on its own to get people involved to do the build out. But we have the support of the tribal council, so that's very, very helpful. Thank you.
Yeah, thank you. That's having an engaged tribal council is always a blessing for the development of some of these programs. And but they're the ones that are high level. They deal with overarching issues, and they have to look at everything and not one particular issue, but how it all relates together and in planning and so on and so forth. And Natasha, you had mentioned HHS and HRSA has a health center program service, excuse me, grants. And that for those grants, the applicants have to describe how they will or plan to use telehealth. And that seems to be like something that might be pretty useful to folks. But given some of the complexities of telehealth, is there technical assistance available to tribes or tribal applicants for these types of grants? Are there other funding resources available for that?
I am not sure about that specific one. I think you have to look more into the requirements and if that was a part of the funding announcement. I mean, I think a lot of people on this call probably are consultants, and that's something that a tribe could reach out to one of these businesses to talk more about technical assistance. I think with the tribes that I've worked with in the past, they do something along those lines, or they just have an internal team that works on this. They have a department, IT department, that works on this for the tribe. And so the healthcare providers that I worked with have like an internal team, but they're usually very small. So I think they could always use more assistance and more bodies that are interested in that.
Would they be able to use some of those big broadband dollars? I think from the infrastructure bill, there's like $2 billion. You had mentioned that earlier. Would they be able to use that?
So I think that might be, we'd have to look more into the details about what it would be for, but I know that some of that direct funding can be used for that kind of stuff. And so I think as long as it's not the actual infrastructure, I think it can be used for that kind of consulting assistance.
Are there consultations that are going to happen for that funding?
That one, I did not find anything. I think that would be appropriate to probably reach out to the tribal person at HRSA or the person listed on grants.gov to learn more about that. But the application is due in February. So I hope it didn't occur already, but yeah.
Well, how about for the broadband under the infrastructure, there's an extra couple billion. Is there going to be consultation for that funding?
So that funding, so they haven't announced what they're going to do for that. And I do hope that they do consultation for that, but I do think that's a little bit different than this other one that you mentioned, because it's already going into an existing program of which they had like 200 something plus applicants. It was more than they expected. And so sometimes a federal agency will just do what they did and just reopen the application. They may decide to do something different. I don't think they've announced that. They did this first round that they did, they just pushed back the notice of awards. It was supposed to be 60 days and now they're going to do it in spring 2022. So I think that is still to be determined. I think, still influenceable if you want to talk to the Department of Commerce about how you want that to be implemented.
Yeah. Well, that's something that we need to be watching out for. The cell tower on wheels, Mr. Arnold. That was really interesting. I think it's something that, well, you have to do what you have to do. When you got a wildfire, you have things happening. You got to take these alternatives to deliver your services. And that was like a temporary measure. But is that something that could be considered an alternative for these different locations that are really remote or in this rugged terrain where it's really going to be difficult to get this broadband out there?
So it's a temporary solution. There's some logistics issues, like each of these things requires electricity, which requires a generator, and typically those are powered by some form of petroleum product. They do have solar powered cell phone towers, but in the winter, getting continuous operation is problematic. They do use these things at the Super Bowl. So if there's websites that actually have pictures of all these things, all different kinds of cows that they've used. I don't think that it's a permanent solution, but I think having a solution like this sort of at your fingertips, having a playbook in case there's a natural disaster is actually quite helpful. I think the Rancho area was extremely fortunate to have such talented IT folks that knew how to reach out to the right people. But these things happen fast, and having a playbook would be with names and phone numbers and what capacity is needed would probably benefit everybody. So if we wanted to have a longer session or a different session to share some of the details of how we set that up, we'd be happy to do that.
Great. Now, you had mentioned regulatory obstacles. That's something that, that's just the federal government. I mean, it's inherent. And as you mentioned, it shouldn't be. We would like to make all of this user friendly, but it happens. And, sometimes there's good reasons for different requirements. But have these all been fully identified and barriers identified, recommendations for changes and that sort of thing?
They're not, it's hard to fully identify them because a lot of times you don't know until you get into integration. So the fact that different insurance or payers have different requirements is something that is hard to appreciate until you actually try to connect systems together to do end-to-end management of records, filing for reimbursements and things like that. And then it becomes extremely painful. And the solution that we use was to actually connect two electronic health record systems together and have a ETL platform, which means you got to have somebody who knows how to do that stuff, and you got to have a computer. So it's very hard. I think that there's some more work that can be done. What I suggest is that, taking a very long view of things, it would be great to have sort of a standard electronic health record. I know there's work in that. And I think people say, well, it's already been done, but it hasn't. These standards are brand new, and that they haven't really been fully fleshed out. ISO is only 66% there by their account. And so there's a lot of work to be done, and it probably costs money to do that. So hopefully that's a helpful answer.
Mhm. Yeah. Getting back to what is available and getting some of these things out to the households. Natasha, you had mentioned the FCC USAC grants, and that was like $75 per household on qualifying tribal lands. What qualifies as qualifying tribal lands? Because you're familiar with Oklahoma and how diverse it is and checkerboarded, and then there are other reservations that may be checkerboarded, and then there are tribes that they have all kinds of different land titles out there. So what qualifies as the qualifying tribal land?
So I think it's a self-identifying thing, and I think that it doesn't have to be trust land specific. I think it's on or near tribal lands, and so that would include, I think it's tribal statistical areas, which would include Oklahoma. And so as long as the FCC USAC hasn't updated what their definition is, I think that that's how a household would decide if they were eligible. And I think that USAC has a little online survey that one can take and decide if they're qualified or not.
Mm.
And if I find that link, I can pass it on to Erin and send it around.
Okay. Well, that would be helpful. Because I don't think this isn't really a new program, is it? The USAC?
No, I think it's been around for a long time. I think the amounts may vary from year to year on reimbursements.
So as far as the qualifying tribal land, it shouldn't really have changed over the years.
I don't think so.
Yeah.
Unless Congress changed it and I wasn't paying attention or something like that.
We actually had this issue in one of our grant applications, and we had to look at section 905A13 and the definition of tribal land. It does actually talk about a former reservation within Oklahoma, so Oklahoma is a special case. And so it took us probably, and my CEO is a very good lawyer, I think it took him a couple of hours to parse through it too. So, but the reference that was in this particular funding opportunity was the section 905A13, if that rings a bell to anybody.
Okay, that's helpful. So we're getting down to the last parts. But before I turn it back over to Erin, I just kind of wanted to ask you all, just globally, what do you think about this in terms of budgeting and funding and resources to get broadband, to get cell phones to the houses or iPads, to help them to access health IT and get to workforce development? What are some of the next steps that we ought to be looking at from a global perspective? And we'll start with you, Mr. Jonathan. Because I know the tribe they're thinking way ahead. So what are some of those global next steps that we ought to be thinking about for health IT?
Well, I think that the short answer is this problem is actually solving the health IT problem means solving workforce development, the last mile, cybersecurity. And I'm sure that there's other organizations that have sort of integrated packages or templates or a process to do that. And then the other thing I would recommend is to take a look at some of the barriers that, every tribal entity has. I just talked about the ones that we encountered, and being able to, see if there's some legislative solutions or regulatory solutions to those.
And Natasha?
Yeah, I think in the space that I work in, I think just raising awareness and then getting tribal coalitions or tribal organizations involved on specific asks, whether that's for funding, whether that's for making it clear that this is something that you can use your compacting contracting funding for, whether, there's additional funding that's needed, for example, like in the EDA program where there were so many applicants that were tribal, like maybe this is something, that still needs to be funded just beyond the pandemic. And just raising that to your members of Congress and just trying to get a coalition around that, I think would really be helpful. More bodies, more asks, raises awareness. So that's what we need.
So one last question. During this BBBA, there is an impression that there is so much money given out to Indian tribes through the different COVID relief packages and ARPA in particular. What do you think? How should we address that narrative that there's so much money out there? Is there enough money out there really to address all of these needs and the future needs and the background needs for broadband and health IT in particular? How could we develop a better educational program to ensure that folks actually know what our needs are?
Well, I think that there was a lot of funding, but I think if we look at some of the needs assessments that have occurred in other areas for Indian country, it doesn't really address all of the need. And so maybe it seems like there was a lot, but there's a huge need. There's always been a huge need. And so this is great that this happened, but I think there's still a need out there for some of these other areas. As far as health IT, I think that there is a need. The Indian Health Service is moving in a new direction. Indian providers were already moving in a new direction. If you think about like cybersecurity for the intelligence community, President Biden came out with an EO on standards and things that should be done there. I think that, if right, I think Jonathan talked about standards. I think if the intelligence community is just emerging on this, I think, hopefully we're behind in the health world. And so I think there will be a huge need. I think some people think that quantum computing is going to make it easier for hackers to get into your password situation. So you need like a 2-step verification program. I think as that develops, like we're going to need more funding on how to protect data, protect, all of that kind of stuff. So I think this is just the tip of the iceberg. I think health IT is the biggest part of a healthcare budget. That's what I've read. That's what the research says. So I think it's just going to continue to be that way. And anything that we can provide as far as a needs assessment in that area for Indian country would be helpful.
Yeah, great. Well, thank you all. Erin, back to you.
Yeah, thank you both to Natasha and John for being wonderful speakers today. And I think those are some really good presentations of looking at it from the 1,000-foot level and then also the on-the-ground level. So, we will share the slides that they shared today at the end of this meeting, and we'll make sure that, if you need to reach out to them, that their contacts are available through that. So I will pass it back to Carolyn Crowder.
Okay, thank you, Erin. Okay, again, I'd like to thank Natasha and Jonathan, who are our first group of panelists, for their